This is probably the biggest rehab centre within a chiropractic program in Australia that I've seen. So it's not just about manipulation, it's not just about massage and so forth, it's also about exercise intervention. So it's quite a well-rounded professional.
告诉大家一个好消息，莫道克大学的脊柱本硕连读项目从5年变成了4年，节省了整整1年时间。4年时间，你可以拿到本科加上硕士学位，而且一个非常利好的消息是，这个课程是带奖学金的，大家可以拿到20%的奖学金。这个专业呢，它是属于澳大利亚的大健康类专业，但是呢，它又不像大健康类专业要求那么高。莫道克大学的脊柱本硕连读项目是能够接受高考成绩的，你的高考成绩只需要达到473分，满分750分，你就可以来申请了。而且雅思呢，也只需要4个6分，是不是真的非常友好？高中毕业生基本上都是可以拿到的。莫道克大学脊柱本硕连读项目呢，也就是在我现在所在的这个校区，这离珀斯呢不是很远啊，大家开车过来也就是20分钟左右的距离。而且莫道克大学的脊柱本硕连读项目是西澳洲唯一开设的脊柱项目，所以说大家后续去找工作的时候呢，跟你一起竞争的申请人基本上都是你的同学，竞争激烈程度就没有那么大了。大家可以看到我身后的这个 chiropractic clinic 就是莫道克大学呢它的一个教学场所，这个也是对外开放的，有很多外来的公众呢会来到这里进行就诊，同学们呢也会在这里进行上课。今天呢我们受到莫道克大学的邀请，一起了解一下这个课程是怎么样的。教授也跟我们 role play 解释了一下这个课程后续成为一个职业人员要做的工作内容是怎么样的，问诊流程是怎么样的，跟我一起来看一下吧。
We do a lot of rehabilitation, so we teach patients how to look after themselves. We teach them how to strengthen their bodies, how to, regain range of motion. This facility, all our students work in this facility at some point. We try and encourage patients to become actively involved in their healthcare. So most of the equipment we have here is fairly low tech, and the reason why it's low tech, like squat racks and so forth, is when patients are at home, they don't have access to machines, but they can have access to, weights. So there's ways you can improvise. This is probably the biggest rehab centre within a chiropractic program in Australia that I've seen. And we do emphasise having that active care component. So it's not just about manipulation, it's not just about massage and so forth, it's also about exercise intervention. So it's quite a well-rounded profession. He's going to go through a little history, a short physical examination, and he's going to demonstrate how he would normally treat a patient like myself. Although it's simulated, just so you can get an idea of what a chiropractor does.
Usually we do this in front of a computer or a book, so we can write down the details.
正常的话，他手里应该会有一个记录的。
How can I help you today?
I've got a bit of lower back pain, and I've got some pain kind of between my shoulders.
Sure. Whereabouts is the lower back pain, just so they can get an idea?
It's just in that area there.
Okay. Do you feel it traveling anywhere, like down the legs?
No leg pain.
And what does it feel like?
Just a dull ache.
A dull?
Sometimes it's a bit sharp.
Would you give it a rating out of 10, 10 being very bad?
About a 5 out of 10.
Okay. What makes it better? What makes it worse?
Standing for long periods of time makes it worse. Bending over to pick up heavy things makes it worse. Lying down makes it feel better. Stretching makes it feel better. And using heat packs makes it
And
feel
do you
better.
recall any particular incident that may have brought this on?
Old age.
25 is not old, Barry.
Not at all.
All right. What about the mid back? Whereabouts are you feeling it in the mid back?
Just a little bit higher up, kind of in that area there.
Okay, between the shoulder blades. Is it affecting your breathing at all?
Nah.
And how did that happen this one?
I think that was from doing bench press, I think.
Okay, going too heavy.
Possible. Yes.
So, did they happen at the same time, both of them, or are they separate?
I have the back pain almost always, and then the pain between my shoulders I've had for about the past 3 weeks.
And out of 10, how bad is the in the middle of it?
That's only about a 3 out of 10.
Both pains are not really affecting your daily living. You can go on
Yeah.
generally comfortably.
I think the lower back pain is more of a problem than the mid back pain.
All right. Do you mind if I do a quick examination,
Yeah,
see
go
what's
for it.
going on? Let's start off with a bit of range of motion while you're sitting down. Okay. So I'm just going to get you to twist the right for me. Good. And twist the left. Good. Any discomfort there when you do that?
Probably just a bit stiff looking to the right.
Going to the right. Where do you feel it? In the mid back or the lower?
Lower back.
Okay.
Yeah.
So down on this right side.
That's right.
All right. And extending back for me. How's that?
That's a bit painful in the middle.
In the middle of the back. What about the lower?
Yeah, it's right in the middle, lower down.
Lean forward. Just touch your toes. Perfect. Come back up. All right. And if I press on this right side and I press on that left side, which one is more uncomfortable?
A little bit tender on the right.
More tender on the right,
Yes.
because that's where the restriction
Yeah.
was. Okay, and give yourself a hug for me. I'll just do a little movement just like that. Any pain in the mid back when I do this?
Just a bit stiff.
Okay. Can I get you to lie on your back first? Okay, I'm just gonna lift your leg up. Let me know if you feel any pain in the lower back. Okay. And no pain going down into the foot,
No,
right?
just tightening the hamstring.
Perfect. And how is that compared to this side?
Probably less tight to the hamstring.
I'll just get you to lie on your, no pain in the hips when I do that. Can I get you to lie on your tummy? The muscles are not very happy here as well. Pain on here? Pain on here? Okay, and keeping your legs straight, and just try and lift it up for me. Good, and back down. And this one here. Good, come back down. What about when I press in the middle of the back? Right in there. Good. And I'm gonna bring both feet together. Perfect. And if I bring them up, any pain in the lower back when I do this? Perfect. Alright, and stand up for me, just one more test. And just put your hand behind, your right hand behind, or your left hand, whatever. And just run it down towards the back of your knee.
That's as far as I can go.
We'll do the other side.
This side's easier.
Have a seat, please. From the examination, looks like you have a little bit of facet, what we call facet dysfunction or facet syndrome in the lower back. Essentially, this will respond well to chiropractic manipulation. Similarly, in the middle of the back as well, that might be the case. It's just locked up joints. So we're going to be performing a maneuver called chiropractic manipulation, which involves fast thrust into the spine. You're going to hear a popping sound, okay, and hopefully that will give you some relief. Okay, now important thing to know, obviously the benefits from that will be increased range of motion, decreased pain, and feeling good overall. There are some minor risks that could happen, which could be an injury to a ligament or sometimes a little muscle strain, but these are very rare instances, and hopefully we're not gonna get that today. Okay.
No worries.
Any questions before we proceed?
Will you be giving me exercises or some stuff I should be doing?
Yes,
at home?
so eventually after we see how you respond to the manual therapy, we will be giving you a few stretches, few exercises, a proper program designed to obviously help fix the discomfort in the mid back. Essentially, it's going to be postural related exercises, that's for the middle of the back, and for the lower back, it's going to be mostly core strengthening exercises to help support all of that here. The idea is we want to try and get you out of pain initially in the first stage, and then give you proper education on how to handle that yourself in the future.
Do I need x-rays?
Not necessarily. Not at this stage at the moment.
Okay.
We usually reserve the x-rays for more sinister, or if we suspect something a little bit more like that we worry about. But in your case, we do not need to refer you for an x-ray.
If I do need x-rays, will I have to go back to my GP to get the x-rays, or can you order
No,
the x-rays?
we can order the x-rays directly, and you can go to a we can x-ray in the clinic on site. If you have the option to go to an external clinic, if you like, the choice is yours. If you're not happy with how the treatment is progressing, they have the option to seek alternative care.
Okay.
If you're not comfortable with the adjustments, if you're not comfortable with exercise prescription, you can always seek alternative pathways.
Oh, I didn't realize chiropractors did their own x-rays.
We are registered to, like part of the degree, we actually learn how to take x-rays, and when you graduate, we just apply for a license straight away without doing any examinations, and we get purely for spinal x-rays. All right, we'll start with the middle of the back first. You're going to be lying on your tummy. I'm just going to apply a little bit of pressure through here. You're going to hear a little cavitation. Is that okay to proceed?
Yep.
It's literally right in the middle of the back here, around T8. All right, take a breath in for me. And breathe out all the way. We'll do a little test. Is that painful?
No.
All right, we're going to do a big one. Take a breath in for me. And breathe out all the way. There you go. There we go. Good. And one more higher up. Take a breath in again. And breathe out all the way. No pain with that? Alright. And let's get you on your side, please, facing me. We do a side posture adjustment. Okay, this one here. Wait. Perfect. Any pain or discomfort lying down? No? I'm just going to push on the middle of the back, middle of the lumbar spine here. Alright, take a breath in for me. And breathe out. Just a little test one. Any pain or discomfort when I do that? Alright, we'll do a big one. Take a breath in. And breathe out. Perfect. Good. And come to the other side. Okay?
Yeah.
Alright, have a seat for me. Let's retest. We'll check the middle. Okay. Okay, there's more range there. How's that feeling when I'm moving you?
Yeah, still a bit stiff between the shoulders, alright, but it's fine.
A little bit, yeah. That will take a couple of goes before it gets better. Obviously, this is the first treatment. You've had this for a while. So it'll take a couple of sessions before you can actually notice a big difference. Let's check the lower back. And leaning forward, touch your toes. All right, come back up. Oh, that's better. More range. Twist to the right. Perfect. Left. No discomfort with that movement?
No.
All right. Okay, that's our first session. We would like to see you again for a follow-up within the next 3 to 4 days. And then if it's all good from there, we can stretch it out for longer, a week or 2 weeks, depending on how you progress. And then our next session, we'll start introducing some exercises to help you with your recovery.
好啦，今天的介绍就到这里了。如果说大家想要了解澳大利亚的脊柱医学类课程，或者说大健康类专业，欢迎联系到我哟。咱们下期再见，拜拜。